If you are someone who spends a great amount of time typing on the computer, or maybe you've recently picked up a new hobby that requires a lot of gripping, then you at some point have probably experienced symptoms consistent with carpal tunnel syndrome. These symptoms can include numbness or tingling in the hands, pain along the wrist and hand area, and maybe even weakness in your grip. In today's video, I wanted to show you some effective exercises that you can use to help fix carpal tunnel without needing surgery. Let's get started. Now, there are various reasons why you might be experiencing pain or numbness in the hands, but in today's video, we're going to focus on exercises that are most effective for carpal tunnel syndrome. Carpal tunnel syndrome is simply when the median nerve, which is a nerve that goes through the hands and travels all the way into the neck, is compressed along the wrist area. This can happen due to overuse of the muscles of the flexors. Typically, this might be using the computer, typing a lot of people in this flex position here, or maybe even if you're doing a lot of hobbies or activities that require a lot of gripping. As a result, this leads to more of a compression along the median nerve in the wrist, which can cause pain, stiffness, and even numbness in the wrist area. So we're gonna go over some exercises that are gonna help improve the mobility in the wrist and help create more room for those nerves and those tendons to glide through. Now, the first thing we're gonna start off with that we have to address is the soft tissue around the wrist. We can do all the stretching we want in the world, but if we're not addressing the soft tissue, which is the fascia and the muscles and the ligaments around the wrist, then we're not solely focusing on the problem. One of the best ways that we can do this is working on a soft tissue massage along the palm and wrist area. Now, if you see here, I've drawn one of the most important ligaments that's involved with this condition, and that's the transverse carpal ligament. As you could tell, this runs perpendicular to the direction that the nerves run. The nerves will start out coming from the neck, travel all the way into the shoulder through the arm, and pass right underneath that ligament. And so one of the best ways that we can help release tension and create more room for the nerves to move is by working on a gentle massage along that ligament. So you can simply just use your thumb here, and you're basically gonna apply a little bit of pressure moving perpendicular to that ligament. So if the ligament is running in this direction, you're gonna go across the ligament. You can even work your way up and down and see how much restriction you hold in that area. This can be an effective way to help create more movement of the skin, of the fascia, and all of the muscles. You might even be able to take that thumb and work your way through the palm area to see if you have any sensitive areas. Now, be very gentle with this self-massage, because if you press too hard, you could cause some irritation of the nerve. What we're simply trying to do is create more room for the nerve to move, and we can do that by massaging along the nerve area, working through some of the fascia and the muscles around that area. So this will be the first way that we can help loosen up some of those structures. And if you really wanted, you might even find some tenderness along the forearm area and just work through those wrist flexors, because these are the muscles that are greatly involved with this condition, especially because those wrist flexors get very tight. Now, the next exercise that you can work on that can help improve mobility of the wrist, further allowing more movement of the nerve, is working on a prayer stretch. So you're gonna clasp your hands together just like so, and your elbows are gonna go to the outside. And what you're gonna do is allow the hands to kind of sink down towards your chest. And as you're doing this, you're requiring the wrist to go in further extension. So you're moving that wrist in this direction, and as a result, it's going to create a nice stretch along the forearm flexors, as well as in the palm area. And you can hold this for about 1 minute. If this is too intense for you, you can back off by gently easing up, bringing your hands up towards the ceiling. And then if you want to feel more of a deeper stretch, and you're working on clasping your hands together and allowing your wrist to go into further extension as your hands are coming together, okay? Now, the next stretch we're gonna move on to is a wrist extension stretch. You can do this by extending that arm in front of you with your palm facing up. You're gonna take that opposite hand and you're gonna press the fingers backwards, creating wrist extension, further allowing the wrist flexors and the palm to stretch again. And I like to explore this with my elbow extended and nice and straight, as well as with my elbow bent in different positions. If you don't know, we have forearm and wrist muscles that actually go across the elbow. So you're gonna be able to stretch those by keeping that elbow straight. But then we also have smaller forearm muscles that are deeper that only go up into the forearm. So you're gonna stretch those by keeping that elbow bent. So both stretches you can spend some time holding for about a minute. Now remember, if you start to feel some pain or even numbness around the hand while you're doing this, then you can ease up on the pressure so that it's not as intense. Now the next exercise we're gonna go over is tendon glides. And what we're trying to do is create more movement of the tendons that run into the hand and to the wrist to allow that nerve to move freely. We can do this by moving your fingers in various positions. The first position will be folding all of your fingers down, moving them in a downward motion and then an upward motion. So you can work on about 30 repetitions where you go up and down there. The next movement we're gonna be doing with the hand is kind of gripping down and folding the top of your fingers there. You can also work on allowing them to straighten up at the top and then folding them down. And once again, with these, you can work on about 30 repetitions at a time. And then the last position we're gonna get into is a full fist. So going from that clasp position to a full fist there, getting some nice movement of the hand there. Now the last stretch that can be greatly effective, especially when your symptoms start to improve and you can tolerate more stretching, is by working on a loaded wrist extension stretch. We can do that by turning our palm away from us and trying to get our palm down on either a table or a bench or even a couch when you're performing this. And it's called loaded because now I'm taking my body and I'm applying a little bit of pressure through that wrist area, which is going to create a more of a stretch in the wrist flexors area. Once again, we can perform this for about 60 seconds at a time, and we're gonna feel a nice stretch through the palm area and the wrist. And one of the best things I like to do with this here is by adding in some gentle rotation. So I'm turning my body inward, I'm turning my body outward. I can even grab onto the tissue around the wrist and also create a torsional force to help loosen up and improve more flexibility of the forearm there. So there you have it, some of the most effective exercises that you can use to help fix carpal tunnel without needing surgery. Now, if you found this video, please give this video a thumbs up. And if you want more information on how to build strength and longevity with your body, please consider subscribing to the channel. Until next time, I'll see you in the next one.